Hello all, good evening. I hope all are doing good and all are ready for your exams, which will be conducted tomorrow. So we'll just have a small discussion on all the four modules which we have discussed yet. Okay, perfect. Now let's begin. Let's begin with this. Now you all guys have been training on this for like from past previous months. You have been preparing, you're being ready for the examinations. Now the day has come, like tomorrow you'll be giving your best. The first thing before even we start discussing writing, I just want to give certain tips on it. On OET writing, you all are aware that there are three types of letter. That is transfer, discharge, and referral letter. These are the three types of letter which you have in your OET exams, and any of these letters can be asked. So you need to be prepared with your preparation materials. You need to be prepared with your knowledge, what you have acquired in these period of training. Now, when you do your reading on case notes, what I want most of the candidates, most of you, like what I want you to do is when you read your case notes, be very sure you identify the target reader first. Now, please understand why we are repeating this again and again on and why we are focusing more on target reader. The reason being is if you identify the target reader, if you're very sure that to whom you're writing the letter, if that is very clear in your mind, it would be pretty easy for you to choose informations, which are relevant. And because in OET, they are more specific on the kind of information what you choose. They want to see that how content nurses you are, that you're able to choose information and process it in a proper sentences. Please remember this and remind your colleagues as well who are there with you. Please be very sure this exam is your language exam, not an exam to assess your medical knowledge. So do not input more medical and technical things into it. You will not be penalized for that, but please understand to whomever you're writing, the intended reader to whom you're writing, that person should be conveyed with everything, whatever you wanted to convey. So you will have to get into the reader's shoes. You'll have to get into the target reader's shoes. Now, apart from this, what I want to talk about assessments. See, I'll tell you what happens in OET assessments, OET reading assessments. There is a criteria which all assessors follow. That is ISBAL. This is a criteria which all like most of the assessors do follow. Okay, now let's see what are these. These five things should be there in your OET writing. So you should make sure that once your letter has been done, you should just reread your letter once again, understand it, and see if these five informations are there in your paper, because this is something what they are looking for. If these informations are present in your letter, I can assure you grade B will be yours. Now, the first thing what you need to identify is, first thing is identify the patient, who the patient is. This is something which we need to identify. Second thing is situation, which will be current situation. Current situation. This should be there in your letter. Anywhere it is there, it does not matter. Structure has got only 20% mark weightage, but the content what you write in your letter contains much more weightage than whatever other structures or whatever things you follow. Your content, whatever content, your language, your proper sentences, your punctuations contains more points. So identify the patient, the current situation, then just a minute. Okay. Third thing, background of the patient. Background of the patient. This is something which they want. They want to know what is the background, which we write in the second paragraph, the history of the patient. So they are looking that, did you mention about the background? Did you mention about the history? That is something what they are looking for. Fourth thing is the current assessment, which means which we write the recent history in the third paragraph. If like my students really know that what structure we follow, if we go into the third paragraph, we write about the recent problems and histories, the recent treatment and the progress. So the current assessment paragraph should be there. What all findings you found in the current assessment, that is something which is required. Fourth one, Fifth one is recommendations or request. Recommendations or request. What we require to mention, which is your fourth paragraph. Now, even an assessor, when they read your letter, this is something they look into your paper. They want you to see that, did you identify the patient? Did you say who the patient is? Did you mention about the current situation? Did you mention about the background of the patient? Did you mention about the current assessment? And did you give the recommendations or request which is required for the target reader to do for the patients? These are the 5 things. Keep it in your mind, write it somewhere, keep it in your mind, and when you go for your exams, once you're done with your test, what I suggest is, like, you have been issued 45 minutes, and the initial 5 minutes is your reading time. In that reading time, please utilize that reading time to identify who the patient is, and before that, who the target reader is. Now, target reader is something which is very important for us to know. We need to identify the target reader. That is something we all need to understand, because if it is very clear in our mind to whom you're writing the letter, I can assure you that the choosing informations in the case notes would be pretty easy for you. And that can make sure that your letter is according to the structure which they are expecting, the examiners, the assessors are expecting. You can make sure that you will not go into any relevant information. Please understand the patient's work profile until and unless it is associated with the current diagnosis. Do not mention that. If patient is not a geriatric patient and patient is a young, what you can say, agitated, or maybe a strong 18-year-old boy going to the outpatient department and no one is there to look after him, that information is not required, because the patient is capable enough. He is self-sufficient enough to manage himself. So please note whatever kind of informations you will be putting out into the letter, into the case notes, whichever you're taking out from the case notes, you need to make sure that information would be necessary. Think on the target reader's point of view. If you're the target reader, for example, you're writing to a dermatologist, so think on his point of view. If you're a dermatologist, what all informations you would expect. Now, we all are medical professionals. We understand what a dermatologist is looking for, what a gynecologist is looking for, maybe what a dietitian or pharmacist. Like, understand the person's point of view, then choose informations from your case notes. Please understand this. So the one thing which you need to keep in your mind when you start your exam is quickly identify the target reader. Okay, now they are not looking for in detail, in depth, the big letters with big words and all. No, do not decorate your essays with whatever words you might have learned, you have mugged up. Do not use that. Be as natural as possible. Whatever collocations you get, whatever kind of word structures you get, you are able to display it over there at that point of time. Please write that way. Do not learn and mug up things and go. Do not do that. That is not a good option. That is not a good way to do it in OET, because according to the demand of the question, you need to change your answers. You need to change your structures. That is something which we need to learn in our day-to-day life when we are preparing for the exam. Not just one day. Just keep these tips and the strategies what we need to write. Do not learn new things. That is not required. My aim behind this video to conduct this session is just to let you know that what all things we need to keep in our mind when we are sitting for the exams tomorrow. So like the 5 minutes, identify the target reader and keep in your mind according to the target reader's point of view, I need to write. Structures, whatever you have learned, it's okay. Even if you do a goof up in structure, it is completely fine. But it does not mean you just put up the history paragraph at the end. So make sure that the proper structure has been followed, but that does not contain much weightage. The more weightage is given to you is on your sentence structures. So once you finish your letter, what I suggest is the 40 minutes is given to you for your writing pattern. What I suggest is use 30 or 35 minutes maximum to write your letter, and keep the last 5 minutes to check your answers. You need to see that is it proper punctuations done. Make sure that you have not made any spelling mistakes. Make sure that you have not used unusual capital letters where it is not required. Also, please avoid contractions. Now, what do I mean by contractions is, please avoid contractions such as D-O-N apostrophe T, don't, C-A-N apostrophe T, can't, and possibility couldn't. Better you write do not, cannot, or could not. It's fine. Do not use anti roots. Do not use contractions. That is not required at all. Okay. So please understand this very clear in your mind. Do not use contractions when it is not required. Okay, that is something which we need to understand when we do our OET writing. Okay, now apart from this, what I want to share is about the transfer letter. Okay, just give me. Okay, perfect. Now that is something which we learn over here in OET writing. Now, when we do a transfer letter, we need to make sure that you mention more about the chief complaints, that is the primary diagnosis, and also you mention more about the secondary complaints. Okay, when you write a transfer letter. Now, what do I mean by this? I have explained the structure. Your first paragraph will be about an overview of the patient. Now, in this first paragraph, I'm just refreshing it like whatever you have learned it. I've taught you all this, but I'm just refreshing it. Overview paragraph, make sure you identify the patient, that is who the patient is. That can be the letter is in regards to the above mentioned patient, who the patient is, who the patient is. That is something which you need to learn. After that, you need to identify what was the diagnosis. That is something which you need to write. After that, you need to write where and when the patient is getting discharged. When the patient is getting discharged. This is something which is very important. When and where the patient is getting discharged. That is something which you need to learn. Just give me a minute. Yes, I'm sorry for that. So when you write a transfer letter, you need to make sure that when and where the patient is getting shifted, that is something which you need to mention, which is very important. Then your purpose comes. What you want the person to be done or what he needs to be doing. So when you go to the second paragraph, this will be about all the chief complaints. And your third paragraph will be about the recent secondary complaints which has developed due to which you're shifting the patient. This is something you need to keep in mind very clear. Your third paragraph should, which is same as discharge letter, all the recent complaints. So you will be describing in the third paragraph all about what secondary complaints has developed because of the primary complaint and due to which you are shifting the patient to other hospital. So this is one thing which need to be like very clear in the transfer letter. I'm not so sure. I believe that I feel because from past four exam dates, I've been seeing that referral letter has been asked. So I believe this time they may ask a discharge letter because transfer letter, according to the history which I see in OET examinations, transfer letters are not much asked, but be prepared with it. It may be a transfer letter, it may be a discharge letter, we are not so sure. But I feel it can be a discharge letter. So you can be prepared with it. Understand one thing, they're not looking for big words, big things. People clear OET examinations very easily. The success rate for OET examination is 65 to 70%. Even now it is increased. So guys, please understand, we don't need that extravagance in language, which we don't need. We don't need all those things. We just need to have a really good English, a normal basic good English, wherein you avoid as much mistakes as possible. That is something which you need to take care of. That's all is required when you write your OET writing. Now, let's move on to reading. If you guys have any questions, anything you want to ask, you can type it in the chat box. And I can see the chat box over here, and I will reply to you whatever messages comes to me. Perfect. Now, let's see in reading. When you do your reading tomorrow, now let's understand its pattern and structure, I can say. Part A contains a total mark weightage of 33%, and part B contains a total mark weightage of 66%. This is the marking criteria which is present in OET examinations. Now, when you do your part A tomorrow, first thing, what I would suggest is before even you start your exams, there would be a big timer displayed in front of you. Do not even look at that. By looking at it, you're not going to make any other difference. Only you're going to trouble yourself. You're going to get nervous. You're going to like go into a panic mode. So the first thing what you can do is do not look at the timer. Just start your work, start your part A, start solving questions one by one. Do not even look at the timer. They will be announcing at 5 minutes left or 10 minutes left, whatever the instructions, they would be announcing it. Do not pay much attention to it. Go with your speed. Do not mess up. Do not goof up. Do not panic. If you panic in part A, you may lose answers. Please understand you only need 33% answers right. Relax. They are not expecting you to solve 30 questions in 15 minutes. No, they want quality of answers, not quantity. So focus on quality of answers. Make sure you do skimming and scanning technique, which you have learned in your practice. Skimming and scanning is nothing but skimming is reading fast and scanning is looking for a particular word. Quickly scan through the passage to find the words related to your question. If in a question the word says research and statistics, go only to the research and statistics passage and make sure you find your answers there. Do not go to any other paragraph. Look for keywords. I'm repeating keywords are the noun and the verb of the question, noun and the verb. Please underline these noun and verb. It can be in the synonym form in the text. Please go and find it that way. Use keywords to find words, and next to that line or next to that paragraph, your answers would be there. I can assure you this is a beautiful way to solve your part A. When you go to part B, make sure you have enough time, guys. I'm repeating it again to all my candidates. 45 minutes is given to you and only 20 questions. So they have not done a favor on you by giving you 45 minutes. Please understand this task requires you to go slow, read, understand, and infer the meaning of what the question has been asked. You need to infer the meaning appropriately. So make sure that you read the question carefully. First thing is, in this point of time, what you can do is you can command yourself. You need to command your brain because your brain functions very differently. You cannot even control it. So you need to command your brain. Word in OET, what I've seen in medical passages is the word still. Whenever there is a word still, please make sure you also be still and read the passage once again, read the line once again, because this one word can change the entire meaning of the sentence. So there is a trick in this. The examiners actually put these qualifying words to see how good is your reading ability, how well you can read and understand things. So that is something which you need to be very sure that there are no qualifying words and there is nothing as such which changes the meaning of the sentence. That is something which I want all of you to do when you are doing this kind of task in reading part A and part B. Part B, we need minimum 15 and maximum, like for maximum, we can go till 20 also, but 15 to 18 answers we need to be right. So make sure your focus, your target, you keep a target in your mind for 20 answers. Now, I'll tell you one thing, guys, everything lies in your thought process, because whatever you have learned in this 3 months is there in your mind. You have absorbed things. Maybe you've gone through various YouTube videos, you would have attended online sessions, you might have done a lot of hard work. So whatever things have you saw like in these many days, everything is absorbed in your mind. So please understand, you just need to unlock those knowledge, what you have been grasping all these days. So it's all your thought process. Make sure tomorrow morning when you get up and go for your exams, make sure your thought process is positive and start believing yourself that you will crack this exam. If these kind of attitudes are there in your mind, I can assure you your score, nobody can stop it. You yourself, only you yourself can stop you. No one else has the ability to stop you from achieving what you need. So you need to make sure your thought process is at the correct place. You need to make sure that when you enter the examination hall, do not hesitate on anything. Do not hesitate that will I be able to do writing session? Will I be able to crack my reading? Do not think that I've paid so much money. Will I be able to make worth out of it? Do not even think such things before your exam. Be relaxed. Believe that whatever you have done is enough for you to clear this exam. Rest is in Almighty's hand. Leave it to Him and do not worry about things. That is all about reading. Now, let's understand quickly and listening what need to be done. The key technique, what we can do is, the first thing what I tell all of my students is, develop when your listening audio starts, be focused from the beginning itself, because initially there will be some guidance, there will be some instructions given to you. Listen to that instructions as well, because even you might have practiced in the practice sessions, you might have heard the same instructions again and again, so you may be bored. But most of the candidates I've seen that when the instructions are going on, they look here and there. They're pretty confident that when the audio starts, I'll get back to the topic and I'll start solving the questions. Do not do that. That's a wrong attitude to do. It's better from the beginning, even the instructions has been played from the beginning, make sure your focus is 100%. You be sure with your focus, because in listening, you need focus. Then after that, develop an interest to know what the topic is. To know what the topic is. Now, the practice materials would have been whatever you have solved would have been at a greater pace, but when you go for your exams, you won't find that difficulty which you might have faced in your practice materials, because practice materials are made in such a way so that you develop your ability. So be relaxed and keep your focus at place. Before even you start your listening, what you can do is reverse, like take 1 minute when the papers have been distributed and when the audios have been, like they are giving you headsets and everything. All those things are going on. Make sure close your eyes for 2 or 5 seconds and count 10 to 1 in a reverse order. Reverse order, because when you do this, your focus comes at place. You will be able to focus more in a better way, because listening will be your first test. You will be very well focused. Settle down yourself, calm down yourself. Do not get panicked, do not get agitated. Relax and do not focus on anything else. Do not even see what the neighbors are doing. Don't do that. Focus on your test, focus on your things. Just keep your focus at place. Then develop an interest. Tell yourself that whatever the communication is going to be played, I want to know about that communication. Be positive about it, because the moment you feel that I want to know what the communication between the doctor and the patient is, you will be able to recollect informations. Whatever you will be listening, if one answer you missed, you couldn't do it, do not wait there, go ahead with the other answers. And when you come back to that question, whenever there is a blank space given to you, when you come back to that questions, you will be able to remember that question. I can guarantee you, you will be able to recollect those informations. That is something which is required when you do your listening test. So I want all of you to follow this. Now, when you move on to your part A, I want you to write everything in the note forms. Do not write anything in a big sentences. Do not write big sentences which is not required. Okay, please understand over here, grammar is overlooked. Grammar is overlooked. You can also relax on spellings. Spellings are also overlooked. There may be difficult spellings which they don't spell it out. So you can write in your own way. There are certain mistakes which they will overlook and you will get your points. Now, the blank spaces you need to count. So if for a question there are 5 blank spaces given to you, you need to make sure you fill all the 5 informations. Please focus on main idea. We don't need fillers such as moreover, however, the sounds which they make. Those all things are not required. We will only focus on the main idea of the communication. Only the main idea need to be written in the blank spaces. No other ideas are required. So this is something which you need to keep in your mind when you are doing your listening module part A. Please write shorter sentences. Make sure you write legible sentences. Now, what do I mean by legible is the examiner should be able to read. Apart from that, you should be able to read when you come to correct it, or when you come to erase it and write it properly. You should be able to understand what you have written. So calm yourself, go very slow, understand, and keep up your pace. Do not worry about anything. Do not even think about anything. I'm pretty sure about all of you guys that you will clear with good scores. Do not worry about that. When you go on to part B in listening, you need to make sure that the sentences, whatever you write, read the questions carefully. And the sentences, whatever you write, you need to write grammatically correct sentence. Grammatically correct sentence. This is something which is required when you do your part B. And at times, when they give you a time to read question 1 to 10, make sure you read questions 1 to 10 and try to make some predictions. What kind of answers I would be looking for, or what kind of audio would be coming for this kind of questions. So whatever time is given to you, if they say read question 1 to 10 or read question 1 to 5, please utilize that time to read and just have a prediction of what kind of audios would be there. Then it would be pretty easy for you to collect answers and write answers about that. That'll be very easy for you. I can guarantee you that in this listening. Also, one more thing, I want to be very clear, guys. In listening, what I've seen with most of the candidate or most of the results which I've seen, what I've seen is, like listening, we get 100% result. 100% result. It is not that difficult at all. Okay, so do not worry about that. Listening is pretty easy. Okay, Nikita, I got a question from you. I'll answer that question at the end of the session. I've received a question from you. I'll answer that. No problem. Now, this is part is all about part B. In part B, when you listen, please make sure grammatically correct sentence. Over there, we need full sentences to write, but also make sure that whenever you're writing full sentences, try to write in such a way that it is not elaborated one. It is not a lengthy one, because you would be losing time. So you need to go slow. Even over here in reading part B, you need to write shorter sentences so that you don't waste time, so that you don't miss out on anything. Listening is pretty easy. Do not worry about that. I can assure you, whatever practice course you've been getting in your practice sessions, but when you'll be doing in your examinations, it will be beautiful. You will be able to do it. Now, when the last thing is speaking is for 2 role play cards. At times, I've also seen that certain people have told me that we have only received 1 task card, which I'm not so sure because I've not heard of. Every time they give you 2 role play cards. So whatever role play cards they give you, make sure you read each and every task of that role play card. You will have to make sure that you read each and every task of that role play card. And task achievement has got maximum score. Task achievement is necessary. You will have to see your speaking need to be divided into 3 parts. Please understand, this is the same mistake which I've been seeing in many candidates. Introduction. Your introduction is important. You need to introduce your name, your designation, and your greetings. How may I help you, or may I know your name? Can we start with your name? Anything, whatever you want to say, you can say. Introduction is necessary. Then comes your body. Your body is you move through each and every task of speaking and you speak about it. Also give some space in between so that if your examiner, your assessor, your interlocutor wants to ask a question, let him ask. Okay, so you will have to make sure. So also the first word of your speaking test will tell you what need to be done. Such as if the word such as explain. Whenever there is a word explain, your examiner will also have 1 question to this task which is given to you. Whenever there is a word inform in the beginning, you can upfrontly give an information. Words such as ask more about, which means you can upfrontly ask the question. But whenever there is a word explain, there will be a question which your assessor will be putting forward. So you will have to give some space wherein your examiner can speak. And you will have to make sure you maintain the natural scenario of the hospital setup, which is very much required. You will have to actually feel and believe that you're actually speaking to a patient, which will make sure that you be very natural and your communication will be more effective. So I want all of you to have an effective communication. That is something which is required when you do your OET speaking. Now, the last thing in your speaking, what is required is conclusion. I want you all to conclude properly. I want all of you to conclude properly. Okay, this is not, I'll just write it once again. Okay, wait a minute. Some glitch. Okay, conclusion. Conclusion is something which we require when you do your speaking, when you end your speaking. That is something which is required. So it's like introduction. You introduce your name, your things, and all those things. Then comes your body. Then comes your conclusion. These 3 things. Conclusion is nothing but you summarize what you have spoken. Now, summarizing does not mean that you go through each and every task which is required. It does not mean that. Summarizing means you just have a smooth ending. Okay, Mr. Smith. So like, for example, Mr. Smith, I believe that you understood the advices what I've given, but still I understand your concern and understand the pain what you're going through. But I'm very sure by following these advices, soon you will be completely well and it will help you with your speedy recovery. This kind of smooth end is required. You cannot stop a conversation abruptly. Now, there may be scenarios wherein the examiners feel like in 4 minutes, 3 or 4 minutes, you have finished your task and there is still time pending. What phrases to use while summarizing? Okay, not a worry. Stephen, I'll answer this question once I end the session. Okay, now when you're summarizing, you need to make sure that when you're doing this task, you need to actually make sure that you convey the things whatever is required, and you need to make sure that all these 3 parts have been maintained. And before even you start, you also check for the settings which is given on the top. Settings would be given. Where are you sitting? Are you sitting in the hospital? Are you sitting in the clinic? Where are you sitting? That would be given over there. So you guys can check with the settings and accordingly you speak. You need to maintain a natural pace which is required. The people who have high pace, like they speak very fast, tap your fingers on your lap when you sit for your exam because they cannot see what you're doing. Tap your fingers slowly. You will understand your speaking pace, your actually the speed at which you speak will be synchronized with your tap and you will automatically start speaking slow. So those who have those high speeds, be very confident. In the initial 5 minutes, they give you the preparation time 2 to 3 minutes. If you have any questions, please do ask. But please understand the person who's sitting in front of you is not an assessor. He's just an interlocutor who will be conducting your role play. He's also non-medical person. So do not ask any medical questions. They will give you the same response. Please do not worry about that. This is not a medical examination. This is just your language examinations. This is the same response what you would be getting. Now, let me see in the questions. Okay. Okay, the question is that, hello, sir, I have a query that please tell me if a 75-year-old patient is discharged home and we are asked to request a home nurse to make a visit at patient's home. Is it a discharge? It is a discharge letter because you're but you're writing it to a nursing home. Request a home nurse, you will be writing it to a home nurse directly. It is a discharge letter wherein you will be writing everything about the discharge follow, what need to be done in future, since you're not writing it to a nursing care agency. Now, one more thing I want to clarify, this I have clarified in the classroom itself, that if your letter does not have multiple events or multiple dates, you need to follow the same discharge letter structure. Please make sure the 5 things what I mentioned, identifying the patient, the background, the current situation, the assessment, and the recommendations, these 5 things need to be present in your letter. That is something which you need to take off. Rest of the things are not required. Okay, do not worry about that. It's pretty simple. Just keep your discharge letter in your mind. If you get multiple events, take your referral letter structure into your mind. So whatever 3 structures what I've taught, keep it ready. But according to the demand of the question, you need to change the structure. Now, Stephen, the question is what phrases to use while summarizing? You can start with his name. Okay, so Mr. Smith, I believe that you understood whatever we have discussed, or you can also start with, we have discussed the pain management for your surgery, which you've been going through. And I believe that whatever advices what I've given you, you will be completely comfortable with and your pain will be relieved. There is nothing of particular phrases. Do not learn things, do not mug up things, do not repeat the same thing again and again what you do. Please change according to the demand of the particular situation. Be confident, like be very confident when you're sitting for examinations. Be confident and speak about your topic. That is all is required, nothing else is required. Okay, guys. Now, if anyone has any doubt before your examinations, you want to contact me, you want to talk to me, you can definitely contact me on 7715-084-900. I'll just put the country code as well. You can call me, you can message me, you can WhatsApp me, whatever you need, you can definitely ask me. I will be there to help you till your exams tomorrow. So please message me anytime on this number. You can note down this number. Please contact me on this number. Any problems, any troubles, any doubts, any last minute tips you need, please do contact me. I will be there to help you. Okay, guys, so that's all about this sessions. Thank you so much for your time. Thank you so much for attending these sessions. And I believe that all of you will get good scores. Do not worry. The first process towards your examination, the successful result is have a good thought process, have a positive thought process. Believe from today that you're going to crack it. Faith and belief makes a lot of things which you cannot even imagine. Those things happen when you start putting this into your belief system that I can crack it. This is completely your mind process. So from today, from now, make sure that you put into your belief system that I'm going to achieve this. Nobody can stop you from achieving this. I'm very sure about it. Then the rest of the things, leave it to Almighty. He's there to help you. Nothing will be there. It will be pretty easy. Tomorrow's examinations, I believe for all of you, is going to be very easy. God bless all. Thank you so much. Have a good day. Bye-bye.